So about, I don't know, 40 to 75% of the federal workforce is furloughed across health and human services, just depending on what arm they're in, right? A CDC, FDA, NIH. A lot of these federal employees are also embedded in state and local health departments. One state health department I was talking to has more than 100 federal employees that are now
Hmm.
just stopped. And like that obviously really impacts public health services and can definitely start impacting Americans on the ground. And so I've been really trying to think through like what is being felt now. And of course, the longer this goes out, and it doesn't really look like there's much end in sight, how much these gaps are become widened. So most immediately, data is impacted. A lot of federal dashboards are paused. Wastewater isn't being updated except for measles, for example. Telehealth for Medicare, this was huge. This was a pandemic era rule that allowed Medicare patients to see doctors from home, and that expired. This is going to remain unavailable unless Congress includes it in the next spending bill, really cutting off access for many homebound seniors, especially in rural areas. And delay right now, like immediate is delays in healthcare help, right? Like if you're a Medicare or Medicaid and call and have a question about your coverage, you can just expect longer wait times and probably maybe delays in your care. Next immediate is WIC, which is Women, Infants, and Children. This provides foods and formulas to more than 7 million women and children across the United States. They have funding to operate for about 2 more weeks. So hopefully this doesn't go beyond 2 more weeks. Um, and then what is also safe through October, but if this continues through November, SNAP benefits and payouts for SNAP, as well as federally funded school lunches, may be dramatically impacted because a lot of these programs just don't have the runway and the cash to just keep these afloat while the government is shut down. So I don't know, I think bottom line, the longer this continues, the wider the problems are going to get, missed outbreaks, delayed guidance, et cetera. And I think it is in everyone's interest to really get this moving and get this government working again.